Welcome to It's Getting Better All the Time Mental Health Outreach with your host, Sister A. Legree. You can find out more about us by logging onto our website at igbatt.com. And again, today, this is Saturday, June the 13th, and I wanted to take just a few minutes to talk. For many of us, we are moving into what is called phase 2. As far as it relates to the pandemic. In some places, we are still seeing the negative impact of the virus. In some places, it's decreasing. I think all of us are now adjusting to what they call the new normal. Everyone is wearing masks or should be wearing masks, gloves, social distancing, which is the new normal. What I wanted to do was just take a few minutes just to share a few things, observations. I think now that we are moving into phase 2, and many of us have come to the realization that this is our new normal, as it relates to living with a severe and persistent mental illness or mental illness, there are a couple of things I think now we need to make sure that we have in place. First of all, I said this before, but I'm saying it again. Now that we've seen what happened, for many of us it was instant shutdown. Everyone by now should have a free phone. I think I said this before, I'm sure I did. You need to have a free phone. And again, I'm thinking in particular our loved ones who are impacted with the severe and persistent mental illnesses and who don't have a way to contact people. You really need to have a phone. If you are receiving any type of government benefits, you can get a phone for free. So again, everyone needs to have their free phone. That is so important. The free phone. Also, you want to have a phone that has some type of app or that will allow you to talk face-to-face with an individual as much as possible. If you are connected, and again, I'm talking to, if you're a person living with the symptoms of an illness and you have a therapist, counselor, or people come by your house, I'm talking to you right now. It's really important that if you have a free phone, that if you need assistance, that you get assistance now in how to set that phone up and how to download it. I think many people were using Zoom. There are other things out there, but Zoom is the one we were using. So many people were using Zoom, and that will allow you to have a face-to-face visit with your therapist, with your psychiatrist. Some places they were letting you do phone calls, so the psychiatrist was able to make a phone call. I know some doctors, therapists don't really like that. They like to see you, especially as it relates to medication. So again, while we're moving into phase 2 and we have this little lull, if you do not have a free phone, please make sure that you get one and that you keep the phone charged. Make sure that you talk to your psychiatrist, your pharmacist about medications. If you can set up medication delivery now, that would be great. If you can have maybe a couple of days of supply of medications on hand, that would be great. Because again, when the pandemic first started, and when it got to the point where the officials decided that, hey, we needed to make some changes, I can tell you that things almost shut down immediately. It seemed like almost immediately mental health people who normally see you, who normally talk with you, had to think about their own families, and they were off. Clinics were closed. Food centers were closed. I mean, it was just a lot of things that just kind of went dark. So I'm telling you now, in preparation for the next wave, if there is a next wave, we need to plan. I think we cannot. If you're living with a mental illness, the word that you want to think about is self-sufficiency. We talk a lot about being more self-sufficient, but what does that mean? Well, in the new normal, self-sufficient means being able to take care of those things that you need to take care of by yourself or with the assistance of very little people, with a small amount of people. So again, having that phone is critical. You cannot, you need that phone to reach out to people. That phone will allow you to call for food. That phone will allow you to let people know you need help. Everyone needs to have that free phone. Also, make sure you have an extra supply of medications. When you go see your doctor, talk to him or her about having a prescription, a refill on your prescription. So that way you're able to kind of get a refill if you need to. Again, that's so important. Now is the time making sure you have some food in your home that you don't touch. It could be just some canned goods, having, of course, the toilet tissue, but just having a stockpile of things that you don't touch that you need in emergency. Because again, many people who relied on the food banks or relied on the free clinics, when this situation really came to a head in certain places, the food bank was not open. The free clinic was not open. Things have started back opening, but they weren't at first. So I can tell you where I work at, we had people who relied on it. They didn't have any food. They didn't have any extra food in their homes, and they relied on going to the food bank. They relied on getting that one meal a day, and it was difficult because myself and some of our staff actually, don our masks even before we knew we needed to wear masks, and just kind of to do what we could to make it happen by making sure people have food and things like that. But I can tell you we were not always able to do that. So again, it's so important for you, or if you're a loved one, if you have a family member who is impacted by severe and persistent mental illness, help them to prepare. Have that phone number, have that pharmacy number on hand. If you can get extra medications, do so. If you can get extra food, canned goods, do so. And we're talking about, canned goods that you're going to eat. I think a lot of times when we're making an emergency kit, we just grab anything to put in the kit, because we don't think we're really going to use it. But plan on using it. So you want to have some food just to kind of last you for a few days. Now that we've kind of know what to expect, always have your extra mask on hand if you need to, because that's so important. Again, preparing is so important. One of the things we want to do is assess. And I wrote down just a couple of things. Assess. Focus on your needs. What do you need now? You need your medications. You need to see a therapist. You need to have food. You need gas. You need to have money. What do you need now? Assess what you need in a crisis. Think about this pandemic that we're in right now. Think about the worst part of it, and how you were shut off and what you needed. Assess your situation. In cases where you are a loved one, assess your loved one's situation. What do they need? Do you have the name of their psychiatrist? Do you know where they go to get their medications? Do you know where the pharmacy is? Do you know how to get medications in an emergency? Have you set up for a free delivery? Again, assess your situation. Okay? Is there someone that you can call if you need to? Do you have their numbers? Do you have the number to the hotline? And have several numbers, because again, the hotline is staffed by people, and people who also have their own challenges and own stressors. They have their own families, and a lot of times, sometimes you may not be able to reach the first person you call. So do an assessment of what it is that you need. Then after you assess, ask around. Ask, okay, I don't know how to get a free phone. Ask how you can get one. Ask where you can apply for your benefits if you need to. Ask questions. You want to assess your situation or your loved one's situation, and then after you assess, ask questions. Where do I go? Who do I need to talk to? What is the pharmacy? I need to ask the pharmacist, hey, can I get an extra supply of medications? If my doctor put it in the script. Ask your doctor, can you give me an extra refill? Is that possible? You want to ask those questions. Next thing you want to do is gather information. Gather information, resources. Who can you call? If you know that you're running out of food and you need food, who can you call? What agency is open? I can tell you a lot of information was put out on the website. I think a lot of agencies, at least in the area where I am, Washington, D.C., Maryland, Virginia, they did a good job, especially Washington, D.C., putting out information on the website. But here's the thing, if you don't have a phone, or if you don't know how to use the website, or if you don't have access to the website, you wouldn't even know about the free information. So again, Now is the time when you go to these places to get hard copy of information so you can post it to your refrigerator, so you can have the phone numbers so you can know who exactly to call. Now is the time to get the free phone. Now is the time to kind of start reaching out to people and asking questions. Now is the time to set up for free delivery or whatever it is that you need. If you can't get out, how are you going to get food? This is the time to kind of do that now. Again, gathering information. Think about your housing. Think about your medical needs. Think about transportation. How do you transitioning, things of that nature. You need to start asking questions now. You don't want to wait until until the second wave. This first wave has taught us a lot, I think. It's taught us a lot about making sure that we're prepared and how important having that phone is, how important knowing how to use the phone, how important knowing how to download the Zoom or any mechanism that will allow you to talk to somebody face to face. If you don't know how to do it, that's fine. Now is the time to learn how to do it. Now is the time to ask someone, hey, show me how to use this phone. Show me how, so I can stay in contact with people, so I don't feel as isolated. So again, this was just a quick little call, a little conversation. We'll talk again, but I really wanted to share that information. You got to have a phone. You need to assess where you are, ask questions, gather information. Do not get lulled into thinking that this may not happen again. This was a prime example of how important it is to be prepared. Now, get a few canned goods, put it under your bed, put it in your cabinet, and just leave it so you can have it, along with the can opener. You want to have that, along with phone numbers, along with extra medications, having the conversation with your doctor. These things are so important. Forming a network now. We've actually started an outreach where, in addition to our outreach, where you can kind of call, where we set up the Zoom calls, igbatt.com. Give us a call. But again, we're doing it by phone, so you got to have a phone, and we're doing it by internet. So either way, so it's really important that you be prepared. So God bless you. This has been It's Getting Better All the Time, Mental Health Outreach. God bless you, and I will talk to you later.